So in ECOG 4151, we sought to answer the question as to whether autologous stem cell transplantation still offers benefit to mantle cell lymphoma patients in the context of our new improved therapeutic options. So we focused on patients who achieved complete remission with induction therapy, and we assessed those patients with PET scan, bone marrow biopsy, and a highly sensitive peripheral blood next generation sequencing minimal residual disease assay, the clonoSEQ assay. And only patients who were in complete remission and MRD negative were eligible for the randomization to answer the primary question. So we had Arm A, which included the transplant and rituximab maintenance, and then Arm B, in which the transplant was omitted and patients just received rituximab maintenance. If patients remained MRD positive, they were put in another arm, Arm C. So as far as the primary question of the trial, looking at overall survival, we saw no significant difference between arms A and B, and we also saw no difference in terms of progression-free survival, and this was true whether we looked at high-risk patients versus low-risk patients by the MIPI score, or whether patients received intensive induction or non-intensive induction. So we feel that this data supports the concept that if patients achieve a very deep remission as measured by this MRD assay, that it is safe to omit the stem cell transplant in those patients. And we feel this is a big step forward because that transplant procedure can be quite difficult for some of these patients and even lead to life-threatening toxicities in some cases.